Hi, my name's Keith Ewing and I'm an internal family systems therapist. And I'm going to do my best to give you a very quick overview of this approach. Basically, internal family systems, or IFS as I will refer to it, works with different parts of ourselves. Although in daily life we often feel like we're kind of a unitary human being, we often talk in parts. So, for example, part of me wants to go to Edinburgh next summer on holiday, but I've got another part that would prefer to go to Cornwall. So if you went to see an IFS therapist with something that was troubling you, some kind of problem, they would guide you to really get to know and bring help to the different parts of yourself, such as anxious parts, depressed parts, sad parts, addicted parts, parts that might be self-critical or self-harming, even suicidal. And we hold in IFS to the belief that no parts are bad and all parts are 100% welcome. So who is it that's getting to know these parts in IFS therapy? Well, it's something we refer to as the self or yourself. It's sort of the core self, the essence of you, which embodies all your finest qualities like courage, calmness, compassion, wisdom, creativity. And then when you work with the parts, you'll probably work with maybe two main parts in IFS therapy. Firstly, there are exiles. Now, these are the vulnerable parts that carry burdens like shame, feelings of being not good enough, being bad or worthless, and many other kinds of feelings like that. Beliefs about ourselves and the world that we've accrued along the way. Now, we call these parts exiles because that's exactly what's happened to them. These difficult feelings, they get exiled in our system, out of sight, and they're exiled because often they're just too much to tolerate. So secondly, there are protector parts, and these are parts that protect us from feeling in the here and now the pain of those exiles. So maybe an example would be good now. Supposing 3-year-old Jenny comes home from nursery with a drawing and shows it to her loving but ambitious and possibly mildly critical parents. And the parents look at the picture and they say, "Oh, that's really good, Jenny, but why is the sun in your picture blue? It really should be yellow, you know. And that stick figure in the other corner, that man, he's only got one leg. He should really have 2 legs, Jenny." So you kind of get the picture. Jenny's parents no doubt love her, but part of Jenny begins to feel not good enough, like she can't quite get things right for her parents. And of course, peeping into the future, it's not hard to imagine that when she gets 10 A stars and 1 B at her GCSEs, the parents will make more of a fuss about the B. So very early on, when she's 3 or 4, an exile gets burdened with this feeling of not good enough. And this is when the other part steps in. We call that the protector part, that says, in effect, "Listen, Jenny, in order to get loved around here, we're going to have to be absolutely perfect." So Jenny's hurt not good enough part is now protected by this perfectionist protector. So if we then fast forward, 40 years, and now 43-year-old Jenny comes in for IFS therapy, hugely successful but not at all happy. The perfectionist protector keeps her in the office for 60 hours a week. She doesn't see much of her partner or children. Her friends say she's a workaholic. The perfectionist part has certainly been driving her bus for decades. So in the IFS therapy, Jenny would firstly get to know the perfectionist part, the protector. That part will gradually reveal its story of just how hard it works to stop Jenny ever again feeling as an adult what the young 3-year-old Jenny felt. And after that, Jenny would start to get to know the 3-year-old hurt part itself. She'd listen to that part, witness its pain, help it to let go of that hurt and sadness, which has been there for years and years. So once that young, not good enough, exile part has been healed in this way, and IFS has a beautiful method called unburdening to help with that, the perfectionist protector then no longer has to be so extreme. It begins to trust that Jenny is now safe from those old feelings, and its role is not required in the same way anymore. So that was just a very quick overview of what you might expect in an IFS internal family systems session. I can highly recommend it as an approach to therapy, but also as an approach to life. Thank you.